Everything okay?
Let me hear the true again.
95%. Yeah.
Okay, we want to test the chair.
Okay, let's start from here.
Everything about the chair.
This is the water. It's coming at this.
Okay.
Air press. Back is in here. Air press.
Vou pra comer down.
Yeah.
Actions.
Papa no food for coming out house.
I want to down.
The pressure of this one is low. Thanks is something. It's because you press the water now.
That's water.
That's water. That's one level. You know, we not put that in it. There's one rope down here. That's not how here.
Yes.
So,
Like you see, you just control the direction of the water.
transfer back. So, get in a shit.
Sounds on you. It's soft sounds. Sounds for.
It's so good.
So you are on the camera.
This is your teeth. I will snap. Boy, come and sit down. Let me snap your teeth. Come and sit down. And then you became. And then you know.
Yeah.
No signals.
Which one is no signal?
My teeth has no signal.
Open your mouth. See, I'm like, oh, boy.
Yeah, snap face. Change it for us. Snap.
Oh, my.
Yeah, then go back. Let's see you to the press. Okay, you got to when you press it for.
It's okay.
Yeah, let me start my own.
I'll snap you now. Snap that. That's what I need to win show now. Let me snap it. Go snap it.
You know how to snap somebody else's teeth. But your own teeth here and then
See, come on now. Now go to let's see what's capture again. So once you look at the picture again.
Pictures.
Yes.
I know how to do this one. I show which is how to do
this port. Okay, this port food. Okay, so it's box.
Arrow down, you go down. Arrow up, you come up. So,
this one is stuff.
Oh yeah, it's fine.
Okay, so it's not.
Yes. So what else? Sir, come and see that. Let's use your interior to do crown. So use it to test our.
no,
Test the lights now.
you do braces for me so that you test.
It's crown. We want to do is crown.
No, I want to do denture for you.
It's denture.
Five denture.
You remove the six one before you do
Yes.
the denture. Yeah, I don't have everything.
Okay. It's working.
Because I'm sure you say the light is too use light here.
It's okay, it's fine.
Everything okay?
Let me hear the true again.
95%. Now we keep the remaining 5 for you now. We can't give you 100%.
For now, you are fit to go. We get back to you.
Get back to me on what?
We need to